on Health Affair, your program of choice, we'll be focusing on some neglected tropical diseases in series. We'll begin with tuberculosis. I remain your regular anchor, Ushuomo Wadanis, and you're welcome. For a reminder, Health Affair is a platform where we focus on public health challenges, issues about women and children, with the sole aim of providing lasting solutions. Let's take you through our new segment for a start.
I have got my car for full body work.
Madam, look, we will shine this car.
Wait. This cough doesn't sound good at all. What are you doing about it?
Oga doesn't want to go to the hospital so that they won't say he has COVID-19.
No, now. Cough is a sign of different infections, including tuberculosis. You would only know which cough it is if you go for testing.
Kai, I've been coughing for more than 2 weeks now.
There's no need to fear. I have done this test myself. To know the right treatment for the particular cough you have, you must first get tested.
Oga Chekamo, make you dey sure. Because
who no go?
No go, no.
Check that cough for tuberculosis.
Chekamo, make you dey sure.
If your cough is more than 2 weeks, it could be tuberculosis. TB tests and TB treatment are free. Just call the National TB Hotline on 3340 for information on where to get the test. This message is brought to you by the Federal Ministry of Health with support from the American people.
Since 2014 to date, Nigeria has witnessed an emerging disease trend from Ebola virus to polio resurgence, meningitis, monkeypox, Lassa fever, cholera, and now the COVID-19 pandemic. Though many lives have been lost due to the outbreaks, more people died as a result of misinformation about these diseases.
The challenge it portends includes confusion, weakening understanding of health messages, and then behavior that needs to be adopted. And then because it's very complex, you have information coming from different sources, and because of technology now, information age, all this information finds itself in the social media space. And it's difficult to know which one is authentic, which one has been peer reviewed.
Remember during the outbreak of Ebola in 2014, there was this misinformation about bathing with salt water, and a lot of people died. Even with the recent COVID-19, we had this issue of people taking chloroquine just anyhow because the information was not disseminated properly. So for us to have that accurate information, good dissemination, correct information out there in the public domain, I think having some level of knowledge or capacity in epidemiology and health related events is a good one.
The key thing is, would there be a next pandemic or an epidemic? The answer is yes. What we don't know is when, but what we can do is what? Prepare. Okay, so that's what we are really about, working together to prepare, to make sure that our systems are strengthened, to make sure that we create more around health awareness, behavior change, so that we are all able to make informed decisions whenever there is a public health event or emergency.
Infodemics has also resulted to a lot of distrust in the management of COVID-19 pandemic, a trend experts say, if not checked, will cause more problems in the future.
There are a lot of clarifications that need to be done about COVID-19. That's why there should be the right communication so that people will be rest assured that this is a disease we can handle.
Strengthening multi-sectoral response to the COVID-19 outbreak. This is what has been our lesson, that health is everybody's business, it's multi-sectoral, and a whole of society approach is what is needed to be able to address a complex situation as a COVID-19 pandemic. The media has a critical role to play in that, not just the media, but every other member of the society. We have the role that the government has to play, and the role that the communities, religious leaders, traditional rulers, and organizations, faith-based organizations, they all have a role to play in making sure that we end this pandemic fast. We want everybody to be responsible in strengthening the kind of information that we get out there in the media space so that we'll be able to deal with misinformation, which is what has fueled the infodemics that we have, that has made it very difficult for us to achieve our target goals for COVID-19.
Recently, I was discussing about Lassa fever outbreak in Bauchi, and one of the things is a particular community they believe is witchcraft. So we really need to do a whole lot of education. We need to do what we call communication for education. To what extent are we promoting hand washing? After you come from the toilet, you finish eating. How are we making that a song that every child, adult knows about? So a whole lot of things has to do with education. Lassa fever, clean your environment, make sure your food is covered. You understand? Block up any holes. Cholera, wash your hands. Do you understand? Also, personal hygiene. And when you feel anything again, hydrate and seek help.
More problems in the future. Resolutions at the end of the media session, according to the Nigeria Center for Disease Control (NCDC), will be used to develop content for training health journalists and media stakeholders on basic epidemiology, on infodemics management, and social behavior change.
The vision of the man, Paul Harris, birthed the global service organization Rotary Club International on the 23rd of February 1905 in Chicago, Illinois, USA. With members now over 1.4 million spread across the world, that day is celebrated annually as Rotary Day of Service. The primary objective of the celebration is to increase membership and highlight the inspiring works of Rotary Club. The year 2022 celebration in Lagos was kick-started with an awareness walk by the district governor, Rotary Remi Bello, and his team from across 5 clubs, namely Rotary Club of Falomo, Rotary Club of Ikoyi, Rotary Club of Ikoyi Metro, Rotary Club of Lagos Central, and Rotary Club of Victoria Island.
Our organization is 117 years old today. I say congratulations to the world. I say congratulations to Rotarians. I say congratulations to people of goodwill. I say congratulations to Rotarians, people of action. Yes, since 1905, our organization has been doing good in the world, and we shall continue to do good.
Most of the times people don't know what we do, but we have said enough is enough, that this is the time to announce Rotary to the whole world.
I think, the thing about Rotary is about service. And the thing about service is that when you give to society, you're also giving back to yourself. Now, the exercise today was aimed at cleaning up parts of Lagos. Like we took a walk on Body Lawn, Awolowo Road and all of that. And it was a cleaning up exercise. But in the course of cleaning up, we're also cleaning up our body in the sense that we were exercising, we were drinking water, we were sweating and getting rid of bad toxins in our system.
The awareness work was followed by a very significant activity of blood donation to save lives.
It's a free will thing. If you're healthy and you are judged, the medical team will do a minimal test, an initial test to ensure that you are healthy enough to donate blood. Once you're healthy enough to donate blood, you're free. Any blood donated, like before it goes into the blood bank, is usually tested. And before it comes out of the blood bank to go to a patient, it's also tested.
Studies have shown that regular blood donors are emotionally stable. Their emotional state is wonderful, and that is because they are saving lives. And with that, they have this sense of well-being because they are doing something that is altruistic. People that donate blood also have a very, very stable iron control. So studies have shown that there is a lower risk of having cancers, there's a lower risk of having cardiac diseases, and there's a lower risk of having liver diseases.
Driven by the vision to promote integrity, peace, understanding, and goodwill across the world, members of Rotary Club International for several years have made life better for a lot of people through environmental protection, disease prevention and treatment, water and sanitation, maternal and child health care. The World Health Organization, WHO, estimates that up to 30,000 children are diagnosed with cancer yearly, and 80% of them live in low and middle-income countries like Nigeria. Cancer that was hitherto thought to be a disease of the adults is silently stealing the country's youths. Driven by a passion to change this situation, Lions Club International has been doing a lot to help. This passion was again demonstrated a few days ago with the donation of a check worth over 300,000 by members of the Keja Unique Lions Club to children at the Lagos State University Teaching Hospital, LASUT, Pediatric Cancer Ward.
All members of the Keja Unique Lions Club will present to the management of Lagos State University Teaching Hospital, Keja, the sum of 370,000 naira, 750 naira. We thought it wise this month because it is the month for cancer awareness, specifically childhood cancer. So in the Lions Club, we have a calendar year whereby we have 5 cardinal programs of the Lions Club International. We have vision, we have diabetes, we have cancer, childhood cancer, we have hunger relief, and diabetes. So those are the 5 cardinal programs of the Lions Club. So this month, we know is the month for childhood cancer, so we thought it wise that it is important that we see how we can offer support to patients within this organization.
What you have decided to come and do here today is a very laudable effort. It will go a long way in helping to provide succor to this very young patient suffering from one type of cancer or the other.
It's a rising phenomenon, and it's something that needs to be attended to very early. I will advise parents and anyone involved to seek early medical attention. It's something that we have to live with, but it can also be dealt with early and quick attention.
The club will also be supporting indigent Nigerians with cataract operation, free eye screening, and lots more in the next few weeks.
We shall be supporting people in our community as well that have cataracts, that are suffering from cataracts. We will be doing the diagnosis and the treatment next month. So that's what we have as part of our activities lined up for next month.
Founded in October 1917 by Melvin Jones, Lions Club International has about 1.4 million members who are dedicated to serving their communities through focus areas like hunger relief, environmental preservation, childhood cancer care, diabetes, youth empowerment, and blindness prevention. To reduce the incidence of HIV infection in Nigeria, more people have been advised to take advantage of self-testing. Speaking at the capacity building workshop for health journalists organized by the Nigerian Business Coalition Against AIDS in partnership with the International Labour Organization, ILO, stakeholders noted that awareness creation and HIV self-testing have become necessary for more people to know their status.
If you have the HIV self-test kit, you can take this test at home and interpret the results yourself. This project is focused on the workforce, the private sector employers and employees, because we understand that they are very busy people and or might not have access to the conventional services. We want to encourage everyone to know their HIV status using the HIV self-test kit so that you can begin treatment on time. And also, I would also like to add that this is not a confirmatory test. This is just the first step. I mean, when you take the HIV, when you use the HIV self-test kit, you need to go to a facility for a confirmatory test. So this is the first step to knowing your HIV status.
People can reach out to NIBUCA if they need the HIV self-test kit. Though we are focusing on the private sector, so organizations, companies can reach out to NIBUCA, and we will take this training on HIV self-testing to them and also distribute the HIV self-test kits to them. So far, we've reached over 2,000 corporate employees in Nigeria with the HIV self-test kits. So please, you can reach out to Naibuka, and we are available to educate you on HIV self-testing and also provide the HIV self-test kits to you for free.
The self-testing kits are designed for employees and corporate workforce from ages 18 to 60 years.
For the storage, it is best if it is kept at room temperature and not exposed to sunlight. We also advise that you do not use if it has been opened.
Available statistics from the World Health Organization, WHO, and other aid agencies show that about 1.9 million people are living with HIV in Nigeria, while about 53,000 AIDS-related deaths are recorded annually. There are also indications that many more deaths will occur in the next few years if urgent tests are not taken, given the high rate of infection among the productive population. Persons with disability are oftentimes prone to abuse and gross human rights violations by the virtue of the fact that they are physically challenged in one way or the other. When it comes to sexual rights violations, they are also not spared, especially the women. It is to defend the interests of this vulnerable group of persons that informed the launch of the standard operating procedure for working with persons with disability in Lagos State. Speakers at the event had one thing or the other to say about the document.
To launch the standard operating procedure for working with persons with disabilities, and specifically in Lagos State, but it's something that could be adopted for use in other states of the Federation. We realize that the persons living with disabilities are a peculiar group of people, that need to be reached specifically. And also because we find out that in most cases, they are excluded in our planning as a nation, in infrastructure provision, in so many other things. And particularly for this project, we're looking at gender and social inclusion. So they're one major group of people that need to be socially included in everything that we do, as a nation.
Because it will enrich our services, especially with the stakeholders and people living with disabilities. It will also open more avenue for people to further understand how to deal with people with disabilities when it comes to sexual, gender-based violence situations.
So the take-home is that everybody in our area of life, wherever we are working, we should bear it in mind that these are people that are need of special protection, and we need to promote their rights.
CEO of Supreme Family Entertainment, Joyce Emily Andrew, has bagged an eminent International Peace Ambassador Award with her husband, Patrick Andrew, from the United Nations.
His Excellency, Ambassador Park Stefton from the Kingdom of Denmark, I hereby present the certificate of honor as an eminent peace ambassador to Ms. Joyce Emily Matthew Andrew as an eminent peace ambassador of the international community. Please can we give a round of applause?
Put your hands together for God.
Authority conferred on me by the World Peace President. I have a present the certificate of an award, an appointment to Patrick Andrew and Nabil as an eminent peace ambassador of the international community. Can we give a round of applause, ladies and gentlemen?
The award, which came as a surprise on her birthday a week ago, is in recognition of her humanitarian work and effort to assist sick children used by some individuals as street beggars in Lagos State.
So excited. In fact, today is the most happiest day in my life. On the day of my birthday, the UN, United Nations, surprised me with an award. In fact, I'm so happy. I'm grateful to God. What actually prompts me is because they are humans and they need to be comfortable, they need to be fine. They need people like us to make them, to achieve back their future. Rescue them, but we end up spending money again. So it's not really easy. I'm calling onto the government to help Supreme Family Entertainment Initiative because we have a lot of grassroots under us that we are taking care of. They need help, they need empowerment, they need to go to school. There are a lot of them walking on the street. We alone cannot do it.
With the help of the Nigerian police force, Joyce and her husband Patrick have reunited many children used as street beggars with their families after treatment. They also appealed to well-placed Nigerians to be of assistance to their neighbors.
Their neighbors, their friends, whosoever, even the people you don't know from the street, support them, help them. A lot of people are there, they cannot even feed a day, and you can feed like 3 times. You can eat, you can have a 3 square meal. Why can't you just donate one to those who don't have none at all?
One passenger, big auntie. Come and enter my bus now.
Hey, conductor, this cough is serious. I beg, you need to go to the hospital.
Hospital? Auntie, if I go hospital now with this cough, those people will just say I have COVID-19.
No, they won't. Doctors say cough symptoms are different in every condition. Some are dry, others are wet, like your own.
God bless you, auntie. I have told this my conductor. The cough has refused to go, and it could be tuberculosis.
Conductor, check am o. Make you dey sure, because who no go, no go, no.
Check that cough for tuberculosis.
Check am o, make you dey sure.
If your cough is more than 2 weeks, it could be tuberculosis. TB test and TB treatment are free. Just call the National TB Hotline on 3340 for information on where to get the test. This message is brought to you by the Federal Ministry of Health with support from the American people.
Welcome back. Nigeria ranks 6th among the first 30 countries with high burden of tuberculosis globally and first in Africa. Despite this high burden, low awareness creation on tuberculosis has been identified as one of the major causes of low tuberculosis case finding in the country, the misconceptions and stigmatization. In this special report you're about to watch, we'll take you through the tuberculosis situation in Nigeria, the implications, challenges, and way forward.
Got a call from my team officers in Lagos, in Adamawa, that 10 patients were diagnosed to have extensive resistance TB. Why must we have 10 cases that are having extensive resistance TB?
Shuaibu Al-Hassan is a pharmacist and one of the public health workers at the Federal Ministry of Health, Abuja, handling tuberculosis, leprosy, and Bruley ulcer diseases. He received a call in my presence of about 10 people who were being diagnosed of drug-resistant tuberculosis from Adamawa State. The call got him worried.
When somebody has STI, it means he has defied the use of all the common anti-TB medicines. It's therefore the last point of the TB management. So for 10 patients to be diagnosed at the same time is something that is worrying the program, worrying all the stakeholders of the TB management team. It's not a good one, and we don't want it, because SDR is a kind of the ultimate, is the last point of management of TB. Beyond that, we will not get any drugs that can manage that patient again. Beyond that, the patient is something anyway, we have medicine for the management of those cases, but we don't want to reach that level of managing the extreme. We want to manage the cases right from when it's at the onset of the case. When you get to the last stage, that is where it became more dangerous and more difficult to manage. And we don't want to reach that level with any patient at all.
Drug-resistant TB or multi-drug resistant TB occurs when the bacteria that causes tuberculosis becomes resistant to the drugs being used for treatment, putting the survival of patients at a greater risk. Whether drug-resistant tuberculosis or the regular tuberculosis, the upsurge in cases and unimpressive rating of Nigeria being sixth in the world and first in Africa, according to the Director and National Coordinator, National Tuberculosis, Leprosy and Brulee Ulcer Control, Dr. Chukwuma Anyaike, is likened to Nigeria sitting upon a keg of gunpowder waiting to explode.
The data we are having show that on a yearly basis we have 444,000 new cases, people being infected newly, not old ones, being infected newly. Now you ask me, where are they? Those ones are in the communities, in the urban slums, in hard-to-reach areas.
Tuberculosis is a potentially serious infectious bacterial disease that mainly affects the lungs, and the bacteria that causes TB are spread when an infected person coughs or sneezes.
It does not respect your age, does not respect your sex, does not respect your social class. Tuberculosis is one of the deadliest bacterial infections. I say this because it disorganizes the system. If you are a breadwinner in your family and you can't go to work, you don't have the strength, of course it has a ripple effect. 2, it can kill you, can collapse your lung, it can even be spread to other parts of the body. That's why we have extrapulmonary tuberculosis. So anything that has to do with your lungs shouldn't be joked with. So it's a highly infectious disease, and we must be very careful in trying to make sure that it does not kill Nigerians. Common symptoms of tuberculosis: weight loss, fever that may not be high grade, weakness of the body, loss of appetite, and cough that has lasted for more than 2 weeks. You go and seek for help. Most of the times, people wake up in the night sweating, even when the environment, the weather is not hot. Weight loss, low-grade fever, cough, and sweating in the night. Of course, to come with other symptoms, depending on the organ, because we have the ones that have gone beyond the lungs. We call them extrapulmonary tuberculosis. So, but these are the classical ones. Once you have it, you go for check.
Tuberculosis is partly preventable by vaccine. The federal government of Nigeria is also offering free tests and treatment for tuberculosis, but not many people are coming out to take advantage of this opportunity.
The government is doing a lot. The tuberculosis test and the treatment, they are free, including the treatment prevention for those that are in contact with the patient that is being treated for tuberculosis, including people that are HIV positive, and we want to prevent them from coming down with tuberculosis because their immunity is low. The government is providing free medicine for all this. But however, the uptake is not enough. So we need the media to educate the people so that they understand what to do, they know where to access care. And we also have, the government has also put in place a toll-free number, 3340, that people can call and ask questions, ask for direction. So all these things the government has put in place, but our people are not accessing it. In addition, the funding is a problem. We don't have enough. So we need the media to be able to, articulate the issues and help our stakeholders, the key decision maker to understand what the issues are and also provide funding. What you don't know, sometimes it becomes a mystery, and there is this wrong perception that maybe it's God that is punishing them, maybe it's witchcraft, maybe it's some other problem, and they start running helter-skelter. So as the National TB program is talking with the media personnel, they are also talking with religious leaders so that they understand that even when you are prayed for this person, that tell the person to still get medication, go to their facility, do the appropriate testing. So while the person is taking the medication, you can continue praying for the person. That way our people can receive the care they need. Some people, when they start the treatment, they start feeling better. The treatment for tuberculosis is minimum of 6 months. So, but by the time you start taking the treatment for like 2 weeks, 3 weeks, the person start feeling better. So they may start doubting maybe it's not actually TB. But by the time the disease will come back, it will come back in a worse scenario. And in the end, sometimes the family will hide the members of the family that has the disease because they are ashamed. There's nothing to be ashamed of. Tuberculosis is completely curable, but the medication has to be taken for minimum of 6 months. And it is the medical people that will certify that you are cured. So the fact that you feel well does not mean that you are okay. For instance, recently in Lagos, in just a school outreach, a child was discovered to have drug-resistant tuberculosis. He must have caught it from somewhere. But the person that was carrying it was not that ill, was not bedridden. That is why our people are not being sensitive to it. By the time the sickness will now start, it becomes a big deal. They are hospitalized and all that.
The TB anywhere is TB everywhere. TB is in the air. So to say it's not my portion is a wish, and we hope it's not going to be the portion of any one of us. However, we live in the world and we need to be very realistic. So anyone can have TB. But TB is not a death sentence. Number one, it is preventable, it is curable, and the treatment and diagnosis are free. It is very dangerous, very, very dangerous to start TB treatment and not complete it, because it will make the bacteria to mutate and come back in a very strong way, which we call drug resistant. And with drug resistant, the treatment is more expensive, it is more painful, it is longer, and it also has some other side effects. So I will kindly implore those who have TB, please, you can quickly get treated, complete your treatment, and you can be free of TB. And if you already started TB treatment, please make sure you complete it. This is the only way that you can be assured that you have been completely cured.
We realize that stigmatization and discrimination is very much entrenched in the community. Even you see the patient himself stigmatizing herself or himself. Health workers stigmatizing fellow health workers. So it's very strong. And the only way that can be removed is when we let people know that tuberculosis is not a disease caused as a result of any sin. It's because there are so many misconceptions going around in our community. Tuberculosis is like any other disease. If people could own up to have diabetes, if people could own up to be hypertensive, so why don't they own up to say that they have tuberculosis and even seek for help, which we all know that both the diagnosis and the treatment are all free.
Of course, everything has to do with leadership. Until Dr. Chukuma Ayake came here, little has been said about the fight against TB. So leadership is important, and that is what we are missing in Nigeria. What he's doing now, sensitizing the media, will help people to know about the gravity of what we are facing in this country. According to him, if a child, a pupil in a primary school or nursery school is infected, that child, that pupil has the capacity of infecting another 15. And those 15 has the capacity of infecting more other people. And from the data they've given, we have about 400,000 new cases. So we are in serious trouble, and it is only by reaching out to those who can help. And I believe that the media can help.
There needs to be more searchlight on rural communities and hard-to-reach areas, because in most of the rural communities, where a lot of them are not even educated, they don't really know, they don't keep to the trend of what is happening. So a lot of them don't even know that tuberculosis is on the rise. Yes, at times the problem happens with the funding, going to these rural communities and all that. But as a person, if you can do it on your own as a human angle story, even if it's one person, go to the community, talk to a survivor, talk to a patient, let people understand the gravity of what we are dealing with. I think it will help us to even look at more cases.
We need to begin to make people understand the need to begin to, good health-seeking behaviors. I mean, most of us, when we get ill, we either do self-medication, or some of us will either say it's from our village people, so they want to go and see prophet, or they see babalawo and all those kinds of things. Now, those things will only make it worse. So for tuberculosis is endemic. I mean, we are missing a lot of cases in the country, and so it's important that we begin to, all stakeholders need to put all hands on deck. From the Federal Ministry of Health to the partners and everybody, they need to, even at the state level to the local government level, we need to begin to go to the communities, especially where these things are, begin to get these cases, because until we get these cases, one person, as they say, can infect between 10 to 15 persons in one day. So imagine that we have over 3,000 missing cases. So you can do the calculation.
There's so much the media can do actually for tuberculosis, to help the fight in Nigeria. And from my belief, I believe the media is actually the missing link between all of those undetected cases and the success that needs to be, reached for the TB fight, because there's so much money, there's so much work the doctors are doing, so many implementing partners are on the field and, doing what they have to do. But many more people do not know what, there is for them to benefit from. Tuberculosis is free, but how many people know it, So for me, I think the media has begun a good work so far. And for what the media needs to do is more human angle stories, take your cameras, take your microphones to the real issues, the real places, so that people would understand that this tuberculosis we're talking about is not an ancient disease, not an alien disease for a particular group of people. Like people think, they say tuberculosis is a poor man's disease, but it's not the truth. If a poor man, forgive me, but if you think your driver, for instance, is a poor man, your driver is driving a big man and he's in the AC car with you, you're prone to it, you're exposed to it, If you think it's your maid is exposed to your children. Your children go to school, they have teachers, they have non-academic staff, who they're exposed to. So it just goes around and comes around, and people really never take it serious, Tuberculosis is really, really the pandemic, much more than COVID, as we think, If you want to put it physically or graphically, they say tuberculosis kills about 157,000 people in a year. That's about 3 air crashes in a year. Do you understand? So imagine that Nigeria had 3 air crashes in a year. You would make that headline news, right? But here it is killing people, and it's not being made headline news because people don't understand the gravity of what it is.
The burden of TB in Nigeria is further being compounded by the COVID-19 pandemic and HIV/AIDS.
You cannot control HIV without TB, you cannot control TB without HIV. And that's still because of the relationship between them. Because someone has HIV and then TB comes up as an opportunistic infection, leads to death. You have not done it, even if you have done everything to cure that HIV or to manage, let's say manage, since HIV cannot be cured, you have done everything to manage that HIV. Without paying attention to the TB will come in and eventually lead to the death of that patient. So there is no how HIV can be managed without TB. And TB, on the other hand, someone with TB already, suffering from TB, can still get HIV. So they are both related, one way or the other. So they have to be taken as a syndemic that they are. That is, both of them are related. So they have to be tackled together in order for us to have any reasonable, better health outcome for the clients. So WHO has laid down goals to achieve collaborative activities. So, and it's geared towards, first of all, having a joint platform, coordinating platform. That is, if we want to talk about TB HIV, we should have one single platform, one single body that consists of both HIV, stakeholders in HIV and TB, so that they can do joint planning. Any planning that they have to do for HIV, TB should be carried along. Then we should take steps towards reducing the burden of HIV amongst TB clients in such a way that every TB patient that comes should be tested for HIV, so that if the person is positive, we know on time, we start care on time, and then health outcome is better. Vice versa also for those that have HIV, at every ARC center, at every visit of a HIV client to the ARC center, he should be symptomatically screened for TB, so that if this is present, it's detected early, treatment is instituted early, and then the client can have a better health outcome.
According to a World Health Organization 2017 global report, 18 Nigerians die of tuberculosis every hour, and the country accounts for over 15% of the global gaps in TB case notification. It has been observed that due to low awareness creation on TB, many people in most communities still have misconceptions which have fueled discrimination and stigmatization, thereby preventing people from coming out to test for TB and access free treatment. To change this narrative, stakeholders are calling for all hands to be on deck, especially the media. Just joining us, it's Health Affair on AIT. Please follow us up on the series as we take you through childhood tuberculosis on the next edition of the program. Now let's take you to our nutrition segment, where we'll give you information about fruits and food items and their nutritional value to enable you make healthy choices.
Beetroot is one of the healthiest vegetables. It is the taproot portion of the beet plant, mostly grown for its edible taproots and leaves. Beetroot, also known as blood turnips, apart from being used as food, is a medicinal plant that has been used for ages in the treatment of numerous conditions. Though beetroot comes in different colors, red is more common. They can be eaten raw, as juice, or eaten as salads. The health benefits of this wonderful plant has been widely researched. Beetroot, due to its low sodium, fat, and high folic content, supports mental and emotional well-being. Beetroot, according to experts, may delay signs of premature aging. It can promote skin, liver, and brain health. It is beneficial during pregnancy. It lowers blood pressure, reduces the risk of heart diseases, aids in cancer prevention, helps fight inflammation, reduces bad cholesterol, levels the risk of diabetes.
Follow me to our clinical segment for tips on healthy living.
I know that naturally Nigerians and most of everybody, everywhere now there's an eatery. Everybody has turned into a chef overnight, but know that monosodium have implications. So we should use them in moderation. Salts and monosodiums should be used in moderations, because when you take them, they exert their activities on your organs, and you can see the rate and speed of kidney failures we have these days.
On how to improve human lives, the nation's health infrastructure, and other sectors of the economy on our perception segment remains a top agenda for us on Health Affairs Desk. So you can participate by calling the numbers showing on your screen.
All be humane in our dealings with people, in everything we do. Today I'm in a position. I should not use that position to oppress and to cause depression to people. Rather, I should use the position as a vantage tool to lift people up and to be kind to humanity. Because what I want people to do to me, that is what I am expected to do to others. So I should not inflict injuries on human beings. I should be kind and have the milk of humanity flowing in my blood to transmit to others.
Don't forget to support the program by advertising your health products and services with us. My name is Oshuomo Daniels. Thanks for staying tuned. Please join us same time next week for another interesting edition of the program. Please keep staying safe.